Sternal precautions are most commonly used after a CABG, or coronary artery bypass grafting. This procedure consists of a surgeon opening up the chest wall by cracking the sternum and spreading the ribs to gain access to the heart. The diseased section of the coronary arteries is bypassed with healthy blood vessels taken from other parts of the body, thus improving circulation. During the surgery, the sternum is split into two for access to the chest cavity. To close the chest, the sternum is wired back together. Sternal precautions protect the suture, limit pain, and prevent the wires from cutting further into the sternum. Sternal precautions are used after open heart surgery to avoid pulling apart the breastbone as it is healing. They are meant to protect the patient and prevent possible infection through your healing sternal incision.
Sternal precautions. Avoid pushing, pulling, leaning, and twisting, including pushing on a chair to sit or stand, opening car doors, leaning onto a walker or surface. Hug a pillow to protect your sternum. When coughing or sneezing, do not lift anything heavier than 5 to 10 pounds, or roughly a gallon of milk. Avoid reaching arms over shoulder height, especially when dressing and during grooming and hygiene.
So this is a simulated treatment session for a patient with post-op sternotomy. Most common surgery is a CABG, so they are limited in function due to their sternal precautions. And so we just kind of want to go over some bed mobility techniques, what the therapist can do to help ease this transition for transfers and then bed mobility. So first thing you want to do is you want to wash your hands as a therapist. And just ask the patient some of their prior level of function type things. Who's at home with them? Who is able to take care of them during the day, and then see how much assistance they needed before the surgery. And so we're looking to see how much assistance they need now. Now what we want to do is we want to instruct the patient to get as close to the edge of the bed as they can. So one way that you could do that is tell them to bridge their legs and hip walk. So you want to tell them to cross their arms so they don't break sternal precautions, and then use their legs to push up through the bed and go over to the side. And then what you want to do is you want to get them flat again, and you want to cross this leg, their opposite leg that's closest to the bed, over the one closest to the bed. Okay? And then you want to allow them to swing this leg off, and then come up easy. All right? And now you want to get them to see if they can use their hips to get slined up to where they're 90, 90, 90, with their ankles 90, knees at 90, and then hips at 90. And then what you want to do from here is you want to put the gait belt on. And one of the things that you have to look at as a therapist is you don't want to put the gait belt up too high at their incision. So you don't want to put it under their armpits, you want to go low, so the gait belt is not pressing up on the incision. And not too tight. Okay, and so normally a patient would have a heart pillow that they would hold on to, and so for this we'll just use this pillow, this normal pillow here. And so you'll instruct them to hold on to that pillow. And so what you want to do is you want to just kind of slide their hips forward, so they're at the edge of the bed. Okay. And then instruct them to lean forward like that, so their nose is over their toes. And then once you do that, you instruct them to come up through their legs, and they can't use anything in their upper extremities, so they're using all legs.
Putting on a shirt over your head. Lay the front of the shirt in your lap with the collar at your knees. Starting from the bottom of the shirt, slide your arms into the sleeves. Push the sleeves up past your elbows. Gather up the body of the shirt with your hands tuck your chin towards your chest. With the elbows rising in front of your face, place the shirt over your head. Adjust the shirt from the shoulders, reach across your belly or from the sides as needed. Taking off your shirt. Reach to the back of your collar with both hands. Pull the shirt over your head. When you remove the sleeves, don't let your elbows move behind your back. Putting on pants and underwear. Start seated, reach forward, and place your legs into the pants as you normally would. Stand and pull your pants up with your elbows out to the side. Hook your fingers into the waistband.
There you go.
Wiggle your hips and lean forward to pull the pants up into place.
Putting on shoes and socks. Start seated. Lift one leg and place your ankle onto the opposite knee, or place your foot on a footstool or on the edge of a bed for support. Reach forward and slip on your sock or shoe as you normally would. To remove your socks and shoes, use the same method or briefly bend over from a sitting position. Standing up from a bed, chair, or toilet. Instruct patient to hug a pillow or cross arms over chest. Instruct patient to lean with their knees over their toes. Use legs to stand. Do not push through the bed, chair, or toilet with your arms. For 6 weeks, do not take a bath. Follow these steps to shower. Wash your underarms and the side of your body by lifting your arm only to shoulder level and reaching across your body. Wash between your legs by reaching front to back. Shampoo, rinse, and dry your hair by reaching both hands to your head at the same time. Keep your elbows in front of your face. Sit to dry your body. To reach your back, flip a towel over the top of your head or put on a terry cloth robe. Raise your arm only to shoulder level, or use both arms with your elbows raised in front of you to comb, style, or shave your hair.
So now that we've done our treatment and we've done all of our ADLs and we've practiced that, we want to get back into the bed or the chair. This kind of applies with that, with both. And so one of the main things that a patient will want to do is when they want to go sit, they want to reach back. And so that's one thing that we don't want to happen. We want to give their heart pillow to them so they're holding on to it, and we want to instruct them to come back. And so they're going to feel the back of the bed on the back of their legs. And so the same concept with the nose over the toes, we're going to lean forward and use their hips to go down. And so one thing that you can do to help ease this is raise and lower the bed. And unfortunately our bed is broken, and so we can't raise it. We'll demonstrate this for you. So you want to lean forward, shoot your hips back, and sit. Just like that. You want to get the pillow from them, put it back so they're nice and cozy with the head. You want to get your gait belt off because it'll be harder if they're laying down to get this off. So same thing, you want to get them to cross their arms over their chest. You want to lay them to their side, so they're laying on their side, and then instruct them to get their legs into the bed, and then transition